reduced rates of positive margins, and re-excision in breast cancer patients undergoing cavity shaving. Survival rate with partial mastectomy in women with early stage of breast cancer is equivalent to total mastectomy. But nearly 20 to 40% of these patients have margins positive for tumor and requires surgery for marginal clearance. Cavity shaving is the removal of additional tissue from the circumference of the cleft left after partial mastectomy. Enrollment of the patients was done from 21st of October 2011 to 25th of November 2013. The age of the patients ranged from 33 to 94 years. Patients who have undergone core needle biopsy and undergoing breast conserving surgery were enrolled. 54 patients had invasive cancer, 45 patients had ductal carcinoma, 125 patients had both cancers, and 11 patients had no cancer. Randomization was done intraoperatively after the surgeons have completed standard partial mastectomy. Patients who have undergone neoadjuvant chemotherapy are included in the study. Patients who underwent excisional biopsy or partial mastectomy are excluded from the study. Until randomization, the study personnel were not aware of the study group assignments. The volume of tissue excision is not fixed. However, the resection should encompass the entire cavity. Positive margins in invasive patients are the tumors touching the edge of the specimen were removed, while in ductal carcinoma patients, it is the tumor that is removed within 1 mm of the edge. Reexcision rate is the proportion of patients who came back to the surgical room for removal of positive margins. Volume of tissue excised is the cubic measure of the tissue removed. Postoperative findings were recorded on a 4-point Likert scale, as the patient reported cosmesis. Sample size was calculated based on normal approximation using the past 2008 software, that is, NCSS, statistical software. SPSS, software version 21.0 is used. Rate of positive margins before randomization were 36% and 34% in shaved and non-shaved groups respectively, with p equals 0.69, that is, statistically significant. Rate of positive margins after randomization were 19% and 34% in shaved and non-shaved groups respectively, with p equals 0.69, that is, statistically significant. Rates of re-excision after randomization were 10% and 21% in shaved and non-shaved groups respectively. The volume of tissue excised before randomization were 74.3 cubic centimeters and 74.2 cubic centimeters in the shaved and non-shaved groups respectively, with p equals 0.92, that is, statistically significant. The volume of tissue excised after randomization were 115.1 cubic centimeters versus 74.2 cubic centimeters in the shaved and non-shaved groups respectively significant. The patients in both the groups had similar perceptions regarding their cosmetic outcomes. The results was statistically significant. In the patients who had partial mastectomy, the rates of recurrence and re-excision were reduced to half with the cavity shaving.